ask for a little indulgence too, because I want us to go back to Dr. Riley for just a second on one of your questions, because part of our duty is not only to get information for ourselves, but to make sure people back home who might be watching it on C-SPAN have an opportunity too. And Dr. Riley, you mentioned surveillance systems. Define that for us. You were talking about nursing and so forth.
So I was talking about having information on COVID infection specifically for pregnant women and lactating women. So that surveillance system that the CDC, ultimately stood up allowed us to then figure out that in fact COVID infection was worse for pregnant women.
I got that, but the problem is I'm not sure folks back home understand what you mean by surveillance system that the CDC stood up. That's what I'm trying to get at. It's just a definition.
Oh, I'm sorry.
That's all right.
Okay, so a way of counting cases of being able to recognize that the patients coming into the hospital are pregnant or not pregnant, lactating, not lactating, race, ethnicity. So getting more information on patients as they come into the hospital or as they leave the intensive care unit, so that you can figure out exactly who's getting sickest.
Thank you very much. That's very helpful. Dr. McBride, at the beginning of the pandemic, the Centers for Medicare and Medicaid Services announced that all elective non-essential procedures should be delayed during COVID-19 outbreak. CMS also stated that the decision to proceed with these procedures would be made by the clinician, patient, hospitals, state and local health departments, et cetera. But as a result of that, patients and doctors across the U.S. postponed procedures. More recently, during the Omicron outbreak, some states and hospital systems continue to grapple with the decision to delay elective or so-called elective procedures to manage care for COVID-19 patients. Looking back on the decisions to postpone procedures, were there any options besides across-the-board postponements that we could have made?
So, as we all know, hindsight is 20/20.
Yes, ma'am.
But I do think it's important to realize moving forward, because we will have another wave of COVID-19, we will have another pandemic, whether it's in 6 years, 6 months, or 6 decades, to recognize that COVID is only one threat to our health and well-being. It's enormous, right? We've lost almost 950,000 American lives. People are suffering from long COVID and other sequelae from the virus. But I think it's also important to realize that elective surgeries, for example, are essential for people to keep people healthy, to prevent the underlying conditions that then put them at higher risk for poor outcomes. So I don't claim to have the solution, but I think we need to make sure that we gather as much information now on the virus, who exactly it affects, so that we tailor our mitigation measures more appropriately to the actual risk, and that we don't do more harm than good with mitigations.
And I appreciate that, because there are situations where harm was done. Because, as I said in my opening, most people, when they hear elective, they think you're talking about something that doesn't need to be done, or cosmetic surgery or something like that, when in often cases it's the diagnosis phase where you're trying to figure out what is wrong. And it may not appear to be an emergency today, but as we know, unfortunately, sometimes it is actually an emergency, or the test would have turned up something that needed to be dealt with right away. All right. Also, Dr. McBride and then also Dr. Riley, during the COVID-19 pandemic, healthcare providers had to adopt remote methods to care for their patients by using telemedicine. This is especially important in underserved and isolated communities where it is more difficult to access care. We know that telemedicine can save lives. I'm glad that the healthcare facilities in my district have taken advantage of the federal grant funds to enhance their capabilities. Did you use telehealth during the pandemic? And if so, what type of equipment did you need to use to monitor patients from home? We'll start with you, Dr. McBride, then we'll go to you, Dr. Riley.
Thank you for that question. So telehealth was a lifeline during the pandemic. I actually wrote an opinion piece in the Washington Post in the spring of 2020 with the former FCC Chairman Reed Hundt about the urgent need to get universal broadband access to all Americans, particularly, as you said, for those in rural communities and marginalized communities who don't have access to internet service, which right now is a beautiful adjunct to, for example, primary care, particularly with mental health care, which, as you know, is a surging and crisis in this country. You know, in-person therapy, in-person Alcoholics Anonymous is probably better than virtual, but virtual therapy and virtual AA is better than no therapy and no AA. So if we can get people the access to the internet services they need, then then we can reach the far corners of
And I
America.
agree with that. What did you use in your practice, or what did you need to update or improve in your practice to make that
We had to
happen?
do a Control-Alt-Delete on how we practice medicine, if you will. So basically Zoom and Microsoft Teams, we had to, I remember the days of getting my 92-year-old patient, for example, to log in to Zoom and do the passwords. I became a tech support in addition to a doctor, trying to help her manage her sore throat. Is it COVID? Is it something else? On Zoom. So, we need better tech capabilities. We need better tech support, not just
All right.
doctors. And we need
And I have
access.
to cut you off because my time's up. And Dr. Riley, I'll probably ask that as a written question. If you could give me your answer in writing to those questions, I would greatly appreciate it, but I must yield back.
I thank the gentleman